at St. John's Ambulance, and today she's here with her casualty patient, Chile Mbaye. You know, they'll be doing things here to show us how to deal with fractures and bone injuries. If you're conducting first aid for somebody, you know, who has broken a bone or has a fracture, how should you do it? Brenda, karibuni tena sana. Let's just start with a brief introduction. Bone injuries, fractures, what do we mean?
Okay, so by bone injuries or fractures, now usually we define a fracture as either a crack or a breakage of the bone. So if the bone cracks a bit, we call that a fracture. If it breaks completely, we also refer to that as a fracture. But also remember, we have something called a dislocation. Now, a dislocation usually happens at a joint. Okay, so a joint is where two bones are intertwined. Yeah, so you have a joint at the wrist, at the ankle, at the knee. So whenever a bone inatokana in place, that is what we call a dislocation. But a fracture usually happens all along bone, which is what we've said, it's either a crack or a breakage. Yeah.
All right, let me just invite our viewers to be part of this conversation. If you have a question for Brenda here, do so. Send it via social media platforms, TV47 Kenya on Facebook, and on YouTube. You can tag me as well on X at Ann Odida. Handle on X is TV47 News KE. Now, Brenda, what's the difference between this dislocation and just having a sprain?
Very good. Now, dislocation is whereby, as you said, two bones that were joined, zimetokana. Okay? But for a sprain or a strain is what we refer to as either a tearing or just overstretching, or what we call a ligament. Now, what is a ligament? A ligament is we call it a string. So a ligament is a string and inashikanisha the two bones. So when that string either overstretches or tears completely, we refer to that as a sprain. Now that one is not very serious because with time it will heal. Okay, but now a dislocation is whereby the two bones who are they have zimetokana. So how can you differentiate between a sprain, a strain, and a dislocation? We say for a sprain and a strain, within 2 days, 3 days, the pain usually goes away. Why? Because the ligament has healed itself. Okay, but for a dislocation, the pain does not go away. So if you think you have sprained your ankle, and you can see that within 2 days, 3 days, the pain is still not going away. In fact, it looks like it is getting worse. Then now that you need to go to a hospital so that they can diagnose and see if it is a dislocation. And most of the time, it will be a dislocation. Yes.
So are there injuries that sometimes feel like fractures but are not really fractures?